celebrities like Angelina Jolie and Christina Applegate decided to tell their story about the family history of breast cancer and their decision. And since then, a lot of people have asked this question that, doctor, I don't have the breast cancer or any lump on my clinical examination, as well as my mammogram is negative. Should I have the double mastectomy, or what should I do? Well, there are different options, but it's not an easy solution, and it takes a lot of thoughts and consideration and involvement. First of all, that not all breast cancer patients who have breast cancer type 1 or BRCA2 do not develop breast cancer in their lifetime. However, as you know that 1 out of 8 women get the breast cancer, and out of those, only 10% will have a BRCA1 and BRCA2, and out of those 10% BRCA1, only 56 to 65% will have breast cancer, and the 45% for the breast cancer type 2. And also the ovarian cancer risk also increases with the BRCA1 and BRCA2. And also it's very important because there are no screening and surveillance test for ovarian cancer, because once they are diagnosed, they are a little bit foregone. So once a person has a family history, like grandmother, mother, sister, or daughter has the breast cancer, and the person is concerned that they might have the breast cancer, and they want to have a preemptive strike. But they have to think that it involves the genetic counseling as well as the gene testing and their options. The genetic counseling will give you thorough pros and cons of all the tests and their options. And the gene testing is not cheap. It's very expensive, about $4,000 a pop, and a lot of insurance companies do not cover it. So you may want to be ready to pay from out of your pocket. Sometimes it can be a heavy financial burden. Also, there are different 3 options. Number one, the person can have the intensive surveillance, which include the mammogram, clinical examination, and the MRI, and sit tight and watch. On the second option is that the person can have the preventive medications like tamoxifen and raloxifene. And there are other medications in the pipe that a person can also get. The third option is that the patient can have the preventive double mastectomy. Why double mastectomy? Because if a person who is BRCA1 or BRCA2 has a breast cancer in one breast, there are 50% chances that the person will have the breast cancer in the other breast. Therefore, the double mastectomy is suggested, and at the same time, it's more emphasized about the ovary. And if the person is not in the productive age of 30 to 40, and then the oophorectomy or removal of ovary is suggested. The third option, which is the double mastectomy, is now quite acceptable to the people because of the reconstruction the techniques which are superb, and the breast reconstruction is quite high quality, and therefore as mentioned, that the person has to go through the genetic counseling and gene testing, and then have to decide what option they would take. And they have to be a personality that accept the decision for the rest of your for the rest of your life. I hope this might give you a little information about deciding as what to do if you are thinking on these lines. And I thank you very much for your listening, and we'll talk more in future.